Shri Neiphiu Rio, Honorable Minister of Urban Development and Municipal Affairs, Dr. Neiphiu Rio, Honorable Minister of Rural Development, Mr. Neiphiu, Honorable Minister of Soil and Water Conservation, Geology and Mining, Mr. Kashiho Santa, Mr. Tobito, Advisor, our department, other dignitaries from the Secretariat and from the visitor from Health Department, District Administrator, members of the press, staff, students of CIHSR. We, the CIHSR staff, student and community, warmly welcome all of you to this very, very auspicious and landmark occasion. Today we are all gathered here to inaugurate, and have been inaugurated, the first capital and cardiac care center of the state of Nagaland.
It's a great delight and a pleasure, a privilege to be able to welcome our Honorable Chief Minister here in our midst on this beautiful day, and along with his honorable colleagues and dignitaries and friends from the government, and friends from the press, our staff, and friends from around Dimapur. Today we just inaugurated the CATLA, Cardiac Care Center, the technical details of which Dr. Abitso will tell you better. I will just tell a little bit about, give you a very quick brief about CIHSR and where we stand today. So in 2005, we, like Dr. Clement just mentioned, we had signed an MOU with the state government, and our Honorable Chief Minister was then the Chief Minister, and it took quite an effort to get that done, but it was, I think, a step which was very important for the health of our state. So the governance structure of our hospital is that we are a society, and the key stakeholders are CMC, EHA, and the Nagaland government. The CMC fellow is predominantly involved in training. So most of our staff, a large number of our staff, I would say about 20% of our staff are trained from Rano, formally. And then they still support us in every possible way. And what we're trying to do is get every department, each department will have a mentor department in Rano who will walk with us. And so that way, then if some of us move on also, there will be continuity. EHA has about 20.
Respected special guest for the event, Shri Neiphiu Rio, the Honorable Chief Minister of Nagaland, members of his team and government dignitaries and ministers who are present here today, representatives from the Health Department, doctors and CEOs of hospitals in and around Dimapur, my dear colleagues and friends here at CIHSR. I and the Cardiac Care Unit team, led by Cath Lab Supervisor Ms. Lanunaro, who is sitting there with the team, would like to once again welcome you all to this special occasion. It has been a dream indeed to have a facility like this at CIHSR, and the dream was presented, as mentioned by Dr. Clement, to the Chief Minister about 3 years back when he came for a kind visit with his team. And we made a proposal of setting up a world-class cardiac care facility here at CIHSR. That would be the first of its kind in the state. We conveyed our readiness for such a high-tech unit to cater to the need for cardiac care in the state, which was sorely lacking. And it is with great pleasure today that we have been saying again and again that we see this dream come into fruition. I will take the next few minutes in updating you all to the technical aspects of the cardiac care unit and also its capabilities. I would also like to acknowledge the presence of representatives from Philips, one of the leaders in cardiac medical imaging technology, the company which has provided us with the best machines available in the world today for setting up this center for heart disease.
Dr. Sarili, Director CIHSR, for addressing us, and Dr. Abitso, cardiologist, for enlightening us about the cath lab and the potentials it has. At this time, I'd like to call upon Dais, our Honorable Chief Minister, Sri Neiphiu Rio, to address the gathering, and following which, I'd like to call upon Dr. Liu to give the concluding remarks.
My honorable colleagues, ministers, advisors, and respected Dr. Sridevi Yangavi, the director of CIHSR, his colleagues, Dr. Avitul Hisse, Dr. Liu, and other doctors and nurses, staff of the CIHSR, officers, and other medical practitioners from the town, friends from the media, ladies and gentlemen. Well, I'm delighted to be with you once again in this institution of CIHSR, and it is my privilege to have come here to inaugurate the Cardiac Care Center. It's a long-awaited dream, and placing this cath lab, which will provide to the people who have this heart and other related problems. It is amazing to learn that since 2005, when the so-called referral hospital of the state was handed over to the CIHSR, and in collaboration with CMC and Inaugural hospital. Over the years, we have grown by leaps and bounds, and your activities in the hospital, you have mentioned. There are so many, but we have not read the numbers, so I cannot say how many. But in addition with today's cath lab, I think this is one of the best, I'm told, machine that is being added to. And this cath lab, the cardiology services, which is badly needed in our state. Yes, there may be other facilities in other places also, but I was told that out of the estimated population of more than 1.3 billion, across the country, about 45 million people suffer from coronary artery disease. So that means it's huge. And it may become the highest number of cases of cardiac vascular diseases in the world. This is very dangerous, and therefore, to have installed this cath lab is a huge relief for the people of the state, including the neighboring villages. We learned that the patient who comes here outside the state is about 40%, particularly from Assam. So that means we are not doing only for our state, but for neighboring states, not only in Assam, but other states also. That is very comforting to learn. Now, I am privileged to have associated myself as Chief Minister from the beginning. And I wanted to see that the CIHSR grows, and we have achieved a lot, but we had more to add. And all of us, we are hoping that one day you will have a full-fledged medical college, which will give immense benefits to our state. And every year we see that so many medical students they want to go for medicine, but our quota is limited. So this time, the Russia and Ukraine, the war and bombing, we had heard that some Swiss students from Nagaland is also studying in Ukraine. That means our students are desperate to study medicine. And I know, I'm aware, even few of my cousins, they are studying outside the country because they cannot get medical seats. And if this hospital come up with medical college, it will be a huge relief. We're trying our best to start the medical college in Kohima, but we're still struggling. And the infrastructure's development is okay, but the management of the hospital and the specialists, super specialists, the scientists, and other specialist people to work in our place, we wonder how it will be. Already the hospital is taking care of a lot of people and adding these facilities. I want to congratulate the CIHSR for your initiative which you shared with me, as you mentioned, in 2019. And in short time, we had sent a proposal to the seat, and they could grant the money. And therefore, not wasting much time, this time we could do. So I'm also grateful to the NEC donor for sanctioning and made our dream comes true. Regarding care center facilities, I have no knowledge about the lab or the medicines, but going to the hospital, observing and seeing the facilities, I think as you have mentioned, we are reassured that our CIHSR will be one of the best hospitals, healthcare unit in the state, if not the region. And I'm more delighted that the referral which you used to do, except in some extreme cases, they did not go out, but can handle here everything, except few cases. That is a very good news to all of us. And so, I hope our people will take the facilities being arranged Because when a referred case is there, then it is not only the patient, it is the attendant, the family, the tension, and lot of inconvenience, not only financial, but also cause immense inconveniences to the family. And therefore, I am extremely happy and I am grateful and I am happy that the doctors and nurses, technicians, and all the staff are doing their best. I come here and I give my comments and go. But today I have made up my mind that we need to give you more support, not in the medical sciences or equipment, but what is visible to me. And I was thinking how to create friendly environment in the hospital. You did a lot of plantations, and first you have to do your road with proper drainages and the footpath, and also you have to clean up your whole complex and grow hedges along the road so that all the dirty things or other which are not pleasant to the eye can be covered. So I will send my R&D engineers to visit the hospital, and we will make a very nice road with footpaths and drainages. And I also sent my forest department to do plantation. Of course, you need a team, and with your support, it is possible only. So, me and my friends, we have come here and we have seen your hard working, your good job done, taking good care of the patients, and particularly during COVID-19. How you have all struggled, including government hospitals and private hospitals. And I think we got the maximum patients, particularly in the ICU and special care. I want to advise that as you are training so many people, and since you are in partnership with the government, you may not be able to reach throughout the state, but I would like the hospital to train the government nurses and staff how to take care of their hospitals and how to handle the patients or consultations through telephones also. In that way, I think where you cannot physically reach also, you can reach all nook and corner. So with these few words, my congratulations again, and I hope our people will be immensely benefited by this cardiac care center in CIHSR. And so, my best wishes to all of you. God bless.